Coming up, your family health history can offer really important clues into your own well-being and maybe what's down the road for you. That couldn't be more true for your mother's side of the family. So this morning, we've got a great topic for you with Dr. Sharon Thompson. She is in our open door green room this Monday to talk about a list of important health questions you need answers from your mom. It'll make a big difference. We'll talk about that coming up. We all know how important it is to see your doctor and also to make good use of the time, right? Have valuable conversations while you're there. Some of the answers to your health questions begin with your mom. And if you're lucky enough to still have your mom around, these are conversations to have right now. Dr. Thompson is joining us this morning with why and knowledge of family history is so crucial. And I imagine you see with patients, plenty of them don't have the answers to these topics.
Oh, absolutely. You know, we say in medicine, 90% of your diagnosis is your history and your physical exam.
Okay.
So even before you do a single lab test, even before you send it for an X-ray or a CAT scan, knowing that history is so important. And so many people don't have the answers, like you pointed out.
Okay, so we've got a list of 7 topics that you should address and have a good understanding of from your maternal health history. So generally, men or women, the maternal health line is more significant?
Both are so important.
Okay.
One of the things, though, that we see with women's health is so many topics are taboo or hush-hush or no one ever talks about it. For example, I'll get a patient who comes in and says, my grandma died from cancer of her uterus.
Yes.
And I'll say, well, what kind? Oh, I don't know. Right? There's no more detail. And remember, in our grandma's day, no one said breast cancer.
Right.
It was secret. It was taboo. No one ever talked about it. So it's so important to explicitly ask these questions because you might find out grandma had cancer, but you don't know what kind.
Okay.
So many of the topics that deal with women's health are the ones that we don't talk about and you have to ask about.
Okay, very important. So one of the things we bring up on this list is heart health as well.
Sure.
Is there a problem with, is there any history of cardiac issues?
Because we know heart disease is the #1 killer of all people.
Yes.
And so to find out, did someone have a heart attack? Did someone have heart failure? If so, what kind of heart failure did they have? Some kinds of heart problems are hereditary, and it means you can't take certain medications. There's a kind of heart disease that young men can get, and they can die catastrophically in sport events. But you don't know that if you don't ask your family history.
And you'd also maybe be making some lifestyle decisions based on if you know you're more likely to have an issue with this down the road. Okay, menstrual cycle and menopause. That's a big thing of you ask your mother, oh, when did your period begin? You expect there to be consistency. Same would be with menopause,
and
right?
That's roughly.
Okay.
Roughly, so it's not exact, but you want to get a sense of what happened with your mom, your aunties, your grandma.
So when she says it's absolutely horrible, then you've got that to look forward to.
Or if she says, I was 38 or I was 35, now you're thinking, hey, may I go into menopause early? What decisions do I want to make about childbearing?
Oh, yeah, very important.
Make a big difference.
Also, pregnancy and childbirth. I mean, a lot of times you'll hear women say, especially from generations past, well, labor is difficult, but you forget all about it immediately. But it's important to remember some of it, right?
Especially how you did during the pregnancy. One key thing I want to point out, that preterm birth is a big problem in America. And if you were an early baby, so if you were born early, you're more likely to have babies that come early. That's a key thing to know from your mom, right? Did I come early, Mom? Did I come on my due date? Or was Mom sick during pregnancy? Did she have high blood pressure? Did she have diabetes? Did she have toxemia? That's what they used to call it in the old days. We now call preeclampsia.
Oh, okay.
Because those can affect your risk of having it and also your heart health going in life.
Oh, okay.
Critical to find out.
Very important for your OBGYN
people often don't think about that.
Cancer histories in general.
Sure, like we talked about earlier. You want to know about, did someone have cancer? What kind of cancer? And also for breast cancer, not just the women, did a man in our family ever have breast cancer? You can imagine that's going to be a hush-hush thing that no one talks about, but so critical to know about.
Also migraines. Is there a history of migraines in the family?
So migraines tend to be familial, and migraines can start early. The average age of migraines in boys is age 6.
Wow.
And it can be age 9 or 10 in girls. So if you're not asking, your child is complaining, you think, oh, you're just complaining. But it may be that they're having migraines. So knowing that family history can help you pick that up.
Okay, very good. And number 6, skin issues. And also, I want to get to the last point before we run out of time, mental health. And that's probably the most taboo, the least talked about, and maybe most important to know.
And so important. Mental health issues, again, it's not exact. If someone was bipolar, you're going to be bipolar. bipolar, but they tend to run in families. And so you have the cousin that no one ever talks about. What was going on there? Even to find out, was it something genetic maybe, or was it something that required medication, required hospitalization? These are such important things to talk about. Mental health issues are so common, and like we talked about last time, can result in tragic events like suicide. So you definitely want to talk to your family, ask those questions. A good way to broach the topic, do a family history.
Okay.
Just find out who's in your family. And as you do that, ask about, well, how did they die, and are they still alive, and what ailments did they have?
You know, and that can be a nice bonding experience as well. I think sometimes we forget to treat our moms like real human beings with their own story and life beyond ourselves.
That is true. Moms have lives.
They do.
I hate to break it to you, but your mom had a life.
Dr.
So find
Thompson,
out more about it.
Thank you so much. Central Phoenix Obstetrics and Gynecology. Appreciate your time.
Welcome.
I will take a quick break. More Good Morning Arizona coming up, and we'll put this on AZ Family as reference.